taking part in this Policy Dialogue seminar today. As some of you may know, Policy Dialogues is a series of seminars from the Johns Hopkins University Universitat Pompeu Fabra Public Policy Centre, which aims to make knowledge around policy making and its impact on people's quality of life, well-being and equity more accessible. Today we're going to be discussing the Superblocks project in Barcelona and its impact on health and equity. Barcelona's Superblocks project is a transformational urban policy initiative that aims to create more healthy and sustainable urban environments based on active transport. And it's contributed to the city's recognition as a pioneer in creating urban environments that respond to the needs of current and future inhabitants in the face of multiple social and ecological crises. However, this transformational urban policy hasn't been completely without criticism or resistance, and its impact in terms of health, equity and sustainability is a complex matter and requires ongoing and in-depth analysis. Which is why today we've invited 3 experts to discuss these important issues. So today we're delighted to welcome Isabelle Anguelovski, Helen and Oriol Marquet to speak in today's policy dialogues. Just a brief introduction of the 3 speakers. So Isabelle is the director of the Barcelona Lab for Urban Environmental Justice and Sustainability, and Marquet, research professor, a senior researcher and principal investigator at the Institute of Environmental Science and Technology, IPTA, and former coordinator of the research group Healthy Cities and Environmental Justice at IMI. Helen is a senior researcher at IPTA and the Autonomous University of Barcelona. She's also a deputy director and co-leader of 2 research lines, urban environment, health and equity, and financialization, housing justice and climate change at the Barcelona Lab for Urban Environmental Justice and Sustainability. And Oriol Marquet is a Ramon y Cajal Fellow at the UAB Geography Department at IPTA. As the leader of the Urban Mobility Research Group at IPTA, he's dedicated to improving transport equity by creating more walkable environments and promoting active transportation. So as the title suggests, all 3 are experts in the topics of policy making for sustainable, healthy and equitable cities, and have extensive knowledge of the Superblocks project in Barcelona. So thank you all very much for joining us today. After the 3 presentations, there'll be an open discussion, so I encourage all of you to participate and think of questions, reflections, and any thoughts and ideas regarding this topic. So without further ado, and also to the people online, please remember to keep your microphones turned off during the presentations. Thanks very much. And you can also write questions in the chat, so at the end we'll be looking through the chat and we'll share some of your questions. Okay, without further ado, I pass over to Isabelle Anguelovski.
Good morning, everyone. Thank you to those of you who have invited us today, in particular to Joanne and to Christos, who are researchers with whom I've done a lot of work and admire a lot of their leadership at the center. So it's been really nice to be here. The paper I'm presenting today is a very recent article that Oriol, Jordi, Hanik, Ruzas and myself have written for Citizen Health, which is an urban health policy-oriented journal, because we really wanted to take advantage of, in some ways, a lot of the press, a lot of the uproar in favor or against the Superblocks in view of the Barcelona election, but just also in general, in view of the growing interest internationally towards this project, to look at one aspect that concerns us a lot at IPTA, which is equity and justice in relationship to transport, transit planning, and green space planning. And so the question for today is equity concerns in transformative planning, Barcelona Superblocks under scrutiny. So as Abe was mentioning, and thank you also to you for making sure we were all coordinated for today, for us, this examination of the Superblock comes within a very ambitious and a very transformative project, which is one that addresses several goals at the same time. And interestingly enough, those goals have evolved over time. And so when Christos, Zographos, and myself and others looked at the early Superblocks, you could see that it was integrated into the 2012 Urban Mobility Plan. So it was meant to be these infrastructure that was remodeling the city in ways that was going to give more space to pedestrians, to the health of residents. So there was this strong health aspect, and then climate mitigation and adaptation goals in particular became kind of integrated in it. So addressing urban heat island effects and making the city more resistant to climate impacts and climate risks. And then now what I'm seeing is actually Janet Sands talking about it as a feminist initiative. That was just yesterday when she presented it for the campaign. So you're like, okay, so it's a plan that evolves. It's a plan that evolves over time and seems to be molded in discourse and in analysis according to the political agendas and the questions at stake, right? These days, to do a gender-friendly and a feminist city is very much in the minds of policymakers and local elected officials. And so our analysis in this paper looks at this intervention that's transformative and at the same time becomes transformed and reshaped over time. And so the questions that we wanted to ask related to equity also take these different goals, these different, let's say, embodiments, right, of the Superblocks into consideration. And we focused on 6 different aspects of equity. And we look at the ones that have emerged and the ones that remain in place. And why also do we focus on equity beyond, our interests? Is because of the fact that equity can be thought about in very different ways. You have the question of distributional equity in environmental justice, who benefits in terms of access to goods and amenities to a certain, through a certain project. You have the question of recognitional justice, which is, all the needs, the identities, the preferences of different groups being met or being even visibilized in different projects. And then you also have the question of procedural justice, the question of who is involved, who is participating, and in which ways. And so that's also what we wanted to look at because, again, of the press and against the uproar around it. So the first question, that has very much been on the mind of people is transformative planning. So in the case of the Superblocks, targeting the neighborhoods that need it the most. And here you have a question, because especially of the goals that become that evolve over time, what does it mean to need it the most? What was clear is that in the 2 original Superblocks, when you look at interviews with planners, some we've conducted, some others have conducted, they were chosen out of convenience, where they were most likely to be successful, where the resistance was going to be less important, and where it would make sense, let's say, from an ease of logistical implementation to have them. The issues verts, so the green axis, which is the latest embodiment of the Superblocks, those have chosen greater public space and contamination criteria, but not the first one. That's something to take into consideration. Where they targeted the neighborhoods that needed it the most, probably not from an environmental contamination standpoint, and even from a public space standpoint. What do we see after a few years? That in Poblano and San Antonio, the first 2 Superblocks, they had contrasting environmental conditions. Poblano, the area that was chosen, was not a heavily trafficked area, was not a heavily contaminated area. So that was definitely not one of the neighborhoods that needed it the most. It was in the Eixample, it was in San Andreu, for example. San Antonio, has greater contamination needs, and when you look at the environmental contamination conditions, NO2 has decreased by 25% in 3 years, according to recent studies, while noise contamination has remained unchanged. And so in that sense, all right, so you already see an environmental impact, and you already see that there was, at least if not on paper, a posteriori, a good contamination justification, let's say, for choosing San Antonio. Then in terms of access to green space, if that's another criteria of environmental equity, Poblano had already quite, neighborhood-based and broader neighborhood access to green space. El Par del Central de Poblano is very close to the Superblocks. The waterfront is very close to the Superblock. San Antonio might have Montjuic, but it's much much more difficult to access, especially if you think about some vulnerable groups like the elderly. So now the very local, as you can see here on the picture, the very local amenities that come together with San Antonio make it, let's say, more accessible from a green space standpoint. So yes, okay, it needed it to some extent. But again, was it also considering what we call now intersectional social environmental needs? Were these two neighborhoods justified? One would say maybe not, because in some ways, No Barris or San Andreu, which have very strong needs for public space, good quality public space, plus contamination threats, let's say, or exposure, those were not excluded. Those were not included from the first, let's say, instances of the superblocks. Second, do transformational projects shift burdens to other sites and neighborhoods? That's a question that has been in the press for a while. Are there rebound effects or are there burden shifts to neighboring streets? Yes, you might green one street, but the rest of the streets are maybe those that are getting more traffic. And if you look at it, there is a question of perception. So for example, in San Antonio, school teachers, residents in some of the streets are reporting a greater noise contamination and feel that the schools are much more exposed, they need to close windows more, kids are complaining about noise. So in that sense, maybe there is a sense of greater noise traffic. But then, recent studies, as the one I'm citing here from Samuel, Neurodikin, this one estimates that actually traffic levels have decreased by 15% on the streets that have been intervened, which is already quite a lot, while traffic in adjacent streets has actually remained very similar. And so in that sense, all the negative press about burden shift doesn't seem to be really taking hold. And at the same time, traffic evaporation dynamics are those that are being, witnessed little by little. Third aspect, are transformational projects helping achieve mobility equity and justice? And so here the question of not only transit justice, but mobility equity has to do with the fact that we're not only looking at the daily needs of people who move through the city for productive activities, for going to work, or in general, to fulfill a certain side of their, let's say, productive lives, but also in general, how we move to fulfill care, responsibilities, or just, in general for other aspects of our lives. And so what we find here is that there are for sure benefits to seniors in these original, let's say, true superblocks, because access to proximity infrastructure, pacified streets and quality green spaces are particularly important for socialization needs, for their physical and mental health. For women with children, it's very similar. So if you live in that particular neighborhood and you have some of those categories, it's great for you. But then if you look at the broader city, those two superblocks in particular, even if you included the Horta superblocks, those are not addressing the mobility needs of working class residents, racialized groups, immigrants in particular, who tend to live in the greater periphery and need much longer, or need to, to move to the city using multimodal transit, and at the same time have much greater distances to move. So in that sense, the mobility, equity, and justice, only some categories of vulnerable groups and only those who likely live in the particular areas. And then if you also look at mobility from the point of view of access to other infrastructure that's not just transport, but also public space, for example, yes, it is true that the elderly, I'm sorry, all of my photos are completely cut in a weird way. I think it's okay, anyway. The presentation looks nice on my screen. You also have the question of comfort and this recognition justice I was talking about. It is not necessarily true that everyone will feel welcome in a particular form of public space infrastructure. And studies we've conducted in surveys we've conducted in Poblano show that the elderly of Poblano do not feel comfortable as much as younger groups and families in going to the public infrastructure of the superblocks of Poblano. It might be very different in San Antonio, as here on the picture, but there is a sense of exclusion, there is a sense that social culturally you are not welcomed if you are, or you're not comfortable if you are an elderly person. So again, there are trade-offs, and it's not clear gray, or it's more gray, let's say, than clear in terms of mobility justice. Then two last points. Is transformational planning contributing to green gentrification? That's a concept we work with a lot. And Barcelona is a city that at the citywide level is experiencing greater green gentrification over time. There is an accelerated dynamic due to parks and greenways. And so, the superblocks might not have a lot of parks associated with them, but they definitely have greenways, especially the new version of the green axle. And the fact that the superblocks have been so branded internationally, the fact that there is so much vibe around it, and so many international design, architecture, media, press, and even beyond the specialized press, praising the superblocks has made Barcelona's identity, which is already very strongly oriented to design and architecture, right, being even more reinforced by these latest embodiment, let's say, of Barcelona's urbanism. And in surveys we've conducted, Helen also was a lead researcher in the study. In Poblano, we found that residents were already reported experiences and concerns about displacement and gentrification. Many of them, most of them, I think it was 65% of the families saying, all of these new infrastructure are wonderful for us, we use them, we go there with our kids, but in the future, this will not be for us. So in the midterm, there are definitely these sense that this will be exclusive infrastructure. There are some mitigation measures in progress, the Nueva Ley de Vivienda. Let's see how that pans out. The Plan de Usos, which has maybe a bit more of a commercial gentrification target, as well as the 30% of social housing construction. Those are mitigation measures against green gentrification, but their impact might be too low and it might come too late. And that's an example of some of the trends that we see in Poblano, with one of the quotes, for example, from a resident, which was, there is no question that the area around Cristobal de Moura is nicer than before, but the question is, why is it nicer? And most importantly, for whom? And if we have time, we can show a short video that illustrates this point about short-term benefit, mid-term likely expulsion of the neighbors. And this plan that somehow seems to be a bit forgotten of, this really integrated way of thinking about the superblocks, improvement of public space, improvement of infrastructure of neighborhoods, reactivation of social fabrics, sustainable mobility, and improvement to public housing provision. Those are really a nice way of thinking transversally about an urbanism project like this one, but it seems a little bit, in the air. So I'm putting it there. Any discussion is very welcome about it or any update, but that was one of the ways, to think about it social and environmentally, but to get more where that went. And then finally, is transformational urban planning contributing to a different model of civic participation in planning and design? That was a very big controversy in the first superblock in Poblano, that it was done in a centralized manner by the Agencia de Ecología Urbana, together with also university-level technicians and experts, and that residents might have been consulted, might have been informed, but that was very early on in the project, and that was not at all in the area where the final, let's say, street design or street redesign was completed in Poblano. Some of the signs, or let's say some of the events, like the one in Blinda Vidal's Cardés that were developed, they were post-implementation, there were some like dinamización del espacio público, but it was not prior to the planning of the super area. So, that one was particularly confrontational and very much received with at least very vocal concern. Whether there was a majority was never clear, but at least there was some vocal concern about it. In the superblock of San Antonio, it doesn't seem to be the case at all. There has been a bit more of a process of earlier communication, earlier involvement with civic groups and families, and the project is very well owned and appropriated by residents. But again here, it does remain a project that seems to be centralized by an architecture vision, a design vision, not an integration of ecology, social, and let's say transit together. So we need new participatory models, including the one via initiatives like the or the Superblocks of care, which are these ways that, at least at first, the city announced that it wanted the Superblocks to become places where different civic groups would own and would use the Superblocks. Big question, is the reconceptualization of the original form and design of the Superblocks addressing equity concerns? One of the big reasonings behind the green axis that we hear is that the Superblocks were ghettos of privilege. You know, they were these blocks that only very specific neighborhoods, very specific clusters benefited from. So having an edge there allows you to have a much greater geographic benefit, at least on paper. The problem is that, yes, in some ways, those green axes are in one of the most contaminated neighborhood district in Barcelona, the Eixample, yet it remains a middle and higher income neighborhood. It remains the center of urbanism, the center of architecture. And just yesterday in El País, there was, this article, I don't know if you saw it, where the residents saying there is no way to rent anything in the Eixample that's below, 15 or 1,800 euros. And all of the ley de vivienda clauses that I was describing, or the 30% of new social housing to be built in any housing project, that's not going to have a strong impact in a very consolidated neighborhood like the Eixample. So from an equity and justice standpoint, still questionable, and of course, that doesn't manage to target the mobility needs of working class residents. Again, the same residents who live more on the periphery of Barcelona. So what we see is that the policy and planning tools towards urban green justice requires an association of both anti-displacement and more equitable green development tools. You need to always think about it also from that point of view. I'm sharing a guide that we developed a year and a half ago called Policy and Planning Tools for Urban Green Justice, with a series of international organizations that gives you 50 different tools from cities around the world that have tried to associate anti-displacement and inclusive greening together. That are some examples. So final thoughts. The green axis, risk watering, all of the synergies that the original project managed to create in relationship to travel behavior, transport habit change, and public space. One of the questions I remember that was Oriol, putting it in the conclusion, are the green axes not just basically, an avenue traffic calming project, as we see in many other cities? Like, what's the hype around it? What exactly is transformative about it that would not be if it was, again, just an avenue pacification project? Some recommendations, of course, to prioritize equity from a mobility and also public space perspective, with very strong housing and anti-speculation measures in place. As much as Barcelona en Comú is trying to change the way participation is done in the city, it's true that it's not just the way they do it that's very complex. It's the way in which our lives are organized. Managing to have people of different socioeconomic backgrounds, ages, cultural abilities participate and encourage participation is really difficult. You need a lot of incentive. You need to pay people to be able to get there. And COVID has had an impact on participation for sure. And then finally, there is a deep need to really monitor both the environmental and the social impacts of the Superblocks. And there are already projects in place, research projects in place with the Agencia de Salud Pública de Barcelona, with the UPF, also with ICTA, with ES Global, and that really needs to reach the policymakers for sure to be able to retarget the initiative. So I think I'll stop here. Thank you.
Thank you so much, Isabelle. We'll now pass over to Helen.
Thank you. So this what I'm going to present today is about a project that my colleague Marguerite and I did 2 years ago. The name of the project is Femme Publique Besene, but I looked up the title of the project because often, we academics, we like to make these fancy acronyms and then we forget what the project was called. So this project was called Strengthening the Impact of Public Spaces to Improve the Health and Well-Being of Barcelona from an intersectional feminist perspective. So just to kind of think back a little bit, this project was part of a program from the Ajuntament de Barcelona that funded research projects related to the COVID pandemic. And so that was the context. And so we're sort of thinking about some of the same issues that Isabelle brought up, but in the specific context of what was happening during and in the recovery of the pandemic, which, we can never say is over. But I think it's interesting because at that time, if you all remember, we were all in our homes locked down. And in Spain, that was particularly intense because we really were in lockdown, unlike people in most other countries that were still enjoying these public open spaces and green spaces during that most intense part of the pandemic. But that also meant that it became this sort of intense time of frantic academic activity, and actually there was a paper published in The Lancet just last week about the gender divide between academic productivity during that time. And of course, men were much more productive, to no one's surprise. But then there was also, so Ita and I are both public health researchers, but we work with a wonderful group of urban planners and urbanists. And so we sort of saw from both sides that our epidemiologic colleagues were busy writing and thinking about the recovery of the pandemic, about the effectiveness of strategies to control the actual virus, and about the healthcare system and all of these things that epidemiologists think about. But we can't forget that also our urbanist colleagues were busy as well, because they were busy redesigning cities and thinking about how this sort of pause in life was going to affect the way that we use cities, and whether or not those temporary interventions that were put in place to increase our ability to social distance would last beyond the time of the pandemic. And also so this project grows out of those things that were happening. I just wanted to bring us back to that time. And because of most of our research leading up to this time was around the health effects of gentrification specifically, and green gentrification even more specifically, we were also thinking about that and thinking about, from an environmental epidemiology perspective, we could think about how green space affects health. But what we like to do is kind of make it even more complicated and say, well, if green space, being exposed to green space is good for your health, what happens when you consider the broader context of change, like when a city is gentrifying and people are being expelled from neighborhoods where there's more green or open space, then what does that mean for the health of the residents, and especially the health of less privileged residents? So, and then from the feminist perspective, we were also thinking about, and many other people were also thinking about this at the time, how women particularly and other gender minorities were more burdened by the pandemic in several ways. One was being overrepresented in these public-facing essential jobs, so like care work, frontline healthcare workers, and other kinds of domestic work. So these were people who were still going to work and still being exposed in an inequitable way to the actual virus, But then women also, as we know, take on more of the care work at home. So this unpaid work that happens, that was even more intense during the pandemic because of the closure of services, and due to children not going to school and things like that. So that's what we were thinking about. So what did we do? So basically we're thinking about the context of the pandemic and thinking that we know that this pandemic context has changed the way that we use and perceive public space, particularly because of the need to social distance and the feeling of safety that being outside was not only felt by people, but being promoted as how we should be behaving. But then we were also thinking that because of all of the economic changes happening during the pandemic, this might affect things that were already happening and changing and affecting the city, such as gentrification and touristification. Touristification in an obvious way because no one could travel, so there really weren't any tourists coming to the city. And then the idea of like what was happening in terms of gentrification processes was a little less clear. And in fact, Pete and I discovered later that we actually had different perceptions of what was what that was being affected. Interestingly, she at the time was in Pocono and I was in San Antonio. So what she saw was that despite that everything was completely stopped, all of the construction happening in the neighborhood was going full force. So there were still the cranes and the construction of all of these new luxury hotels and housing happening, and that didn't stop at all. Whereas in San Antonio, I mean, when we were in lockdown, you really only knew what was happening on your block. So I knew that in my block, there were a lot of vacant homes because a lot of those tourist flats were not being used. And you could tell that the neighborhood was quieter and there weren't as many people, even if we were all in our homes. And at the same time, we were seeing that businesses were suffering because of all of the effects of the pandemic. And so the question was, well, if these, a lot of people were concerned about small family-run businesses, for example. So if those close down, then what's going to replace them? And was still an unknown. So then we thought about how all of these changes and perceptions might affect particularly the health and the well-being of women and other marginalized genders. So how do we go about it? So we did a mixed method study that included a structured survey. So to catch the attention of epidemiologists, you pretty much need to collect quantitative data. And so we did it the best of all possible ways, and we used these already validated measures of, or already tested and used in some ways, if not validated measures of all the constructs we were interested in, which included how people use and perceive public space. And we also tried to find a way to get people in the mindset of thinking about the change in time. So directing them to think about the time just before the lockdown started versus the time directly before they were answering our survey, which was about a year and a half later in most cases. So then we used also a measure of perceived gentrification that had recently been published in the US. We used a couple of questions about touristification. We couldn't find a validated measure, but we used some questions that we'd used in the past in a different survey. And then we also included some very well validated measures of general perceived health and general perceived mental health, and also around social status, so income and vulnerability before and after. And then we also recruited I didn't say that in the end we chose two neighborhoods. One was the Barcelona, which we thought of as a prime example of a neighborhood influenced by touristification, and then San Antonio, which we thought we were thinking of as a neighborhood that was undergoing gentrification. But today I'm just talking about San Antonio. So in each of these neighborhoods, we recruited a community advisory board of 3 women who lived in the neighborhood. And so we also asked them to give us feedback on our data collection tools and on our methods to make sure we weren't missing anything. And one of the things that they told us right away was to measure not just general health and mental health, but also the issue of sleep, which they felt was, especially the women from the Barcelona actually were very concerned about sleep and even felt that it had become more of an issue over time. And so we also included that as a measure of health status. So then we also worked with the Colectivo.6, which is a feminist architecture association here in Barcelona. And they specialize in qualitative methods. And so they did, first of all, a guided walking tour of the neighborhood. And you can see that the map here is the result of the first session in San Antonio. And in that session, they gathered a group of women who were participating, and they asked them to think about what public spaces in the neighborhood they use most often. And then in the second session, you can see they're on the street there. They actually walk to those spaces and talk in each space about how they feel around those spaces and different aspects of the design of the space, whether they feel safe there and things like this. And then in part because we had a fairly low participation in that process, we did a number of qualitative interviews, or actually our colleagues from Hudsis did these interviews to supplement the information we had. So this is the timeline. So as I mentioned before, especially when we were collecting the quantitative data, we tried to use these verbal prompts to get people to think about the 2 years leading up to the lockdown in March of 2020. And then the 2 years leading up to, or the time leading up to the survey. And the survey was conducted between June and November of 2021, more or less. And the qualitative data was collected up through February of 2022. So that was a little more than a year ago. So one thing which I'll mention a little bit later is that this was also a time, during the time that we were actually collecting data, there were a lot of kind of waves of the pandemic itself, which definitely affected how we were able to collect data and how people were thinking about spaces in their neighborhood or their lives in general. For example, in the summer of 2021, there was an outbreak of COVID that was kind of in the media talked about as being maybe even the fault of these young people who were behaving in ways and socializing in ways that were causing this wave. And of course, our data collectors were all young, and so that was one difficult part of the beginning of the data, because we were approaching women on the street to get them to participate in the survey. So just to give you an example. So I just included here some of the general results from the survey. In total, we had 485 participants in San Antonio, of an average age of 46. And a little bit more than half had at least a university degree or a higher level of education. 17% were immigrants from what we termed the global south. Only 49% reported being in a comfortable financial situation. And 33% reported doing some sort of care work. And that we defined as unpaid work that you do in the home or in the community to take care of other people. So this could be caring for children, caring for older family members, caring for people with disabilities, or something similar. And as I mentioned, we also asked them to kind of think about their health before and not after, but during. And what we found is that in general, more participants reported poor general health after or in the during period, or that their health had gotten worse. And more participants also reported poor mental health over time. And the sleep measure was not quite as clear, but they did report slightly worse quality of sleep over time. But I guess the most clear results were that it was very clear that the majority of the participants either increased their use of public space or they maintained their use of public space. And we asked about spaces specifically that are close to their home. So in the case of San Antonio, that would essentially be the Superblock and those small public spaces that are attached to the Superblock. Spaces that are within a short walk from home, I think within 15 minutes, and then spaces that are farther away from home. So this maintaining or increasing use of public space was particularly true when we asked about the spaces closest to home. And then what we found is that this increasing or maintaining use of public space was associated with being more likely to report better health and better mental health. And that was, of course, especially the case for those increasing or maintaining the use of public space near their homes. And we didn't find an association with quality of sleep, and perhaps because the change in sleep wasn't very big. So, then in terms of what we found from the qualitative part, we actually made some short videos that are in San Antonio. We have 2 videos that are the 2 of the women who actually participated in the study talking a bit about their reflections. So I thought we would let them speak for themselves.
Pues me llamo Nuria, soy originalmente de México, de la Ciudad de México. Llegué a Barcelona en el 2008 y vivo en San Antonio hace unos 9 años. Tengo 2 niños pequeños, encuentro que es un barrio muy familiar, pero es un barrio un poco para todo el mundo. Pues yo vivo en el barrio, en la última calle del barrio, en la calle de Aldana. Y mis hijos van a una escuela en Aragón, con lo cual cruzo todo el barrio mínimo una vez al día. La calle que subo es Conta Borrell, que es la que justamente han peatonalizado, así que la disfruto y con los niños pues paramos, nos encanta la superilla, que aunque estás en la ciudad y es totalmente urbano, pero una sensación de que puedes aprovechar el espacio público, ¿no? Que es un poco lo que se ha logrado con Borrell. Yo creo que con la pandemia todo se silenció, sobre todo esta ciudad, ¿no? Que es tan turística, y post pandemia yo creo que tomamos todos conciencia de lo masificados que están ciertos espacios, y a mí esto me pasó con el barrio. Sí que en el barrio justamente hay espacios como el mercado de San Antonio, que son como espacios muy amplios, pero también hay mucho comercio, y esta sensación como de que todo el tiempo estás caminando con gente alrededor, o te la encuentras, la conoces, y la conoces la saludas. Bueno, en general la sensación de que hay todo tipo de personas en el barrio, que por un lado me gusta mucho, pero es cierto que es un barrio donde hay todo el tiempo hay gente en la calle, ¿no? Con la pandemia, una de las cosas que también hemos tomado mucha conciencia ha sido la necesidad de los espacios al aire libre. Que a mí es de las cosas que más me gustan de Barcelona desde que llegué, es que se podía usar el espacio público, se podía usar, te podías sentar, te podías tomar una cerveza, te podías tomar un café, te podías sentar en un banco a hablar, hay bancos para sentarse. Creo que después de la pandemia, bueno, hay más gente viviendo en la calle, y a lo mejor espacios que antes se usaban para conversar, pues a lo mejor ahora ves personas durmiendo ahí. Bueno, yo nunca me he sentido especialmente insegura en el barrio. La verdad es que soy de la Ciudad de México, donde es una ciudad evidentemente muchísimo más insegura. Sin embargo, creo que a mayor conciencia, o sea, entre más conciencia tenemos las mujeres de los peligros que es ser mujer, más miedo sentimos. Bueno, yo creo que culturalmente las mujeres no nos han enseñado a ocupar el espacio de la manera que los hombres. Yo creo que al revés, muy inconscientemente o muy sutilmente nos han enseñado que los espacios hechos son de los hombres y que las mujeres tenemos que respetar que el espacio a veces no es nuestro, ¿no? Y nadie nos lo ha dicho de esa manera, pero al final nos han enseñado a actuar acorde, ¿no? Para mí la clave para que todo espacio público sea exitoso es la inclusión. Los barrios tienen que tener espacios que puedan ser aprovechados para la gente con familias, la gente con hijos, la gente mayor, las mujeres. Tiene que haber como una suerte de colaboración y de inclusión para asegurar que todos los habitantes de un barrio puedan realmente aprovecharlos.
So there were actually 2 videos, but in the interest of time, we'll just leave it at Nadia's perception. The other one you can view on YouTube if you like. So I didn't present the measures of the change of gentrification and touristification. We're still actually trying to tease out a little bit about how that goes, and maybe that relates to Ida and I's differences in perception as well between us. But they weren't quite as clear like what is happening. But we also think that that's because during the time of when we were collecting data, the city was very much still recovering and in different times of recovery with the pandemic. So those also affected the kind of the strength of our results and our ability to kind of detect the things we were wanting to see. But it was clear that the use of public space was associated with this better physical and mental health, and that seemed to be clear in both the quantitative and qualitative data. When during the qualitative data collection, people talked about using this open public space as a way to relax and disconnect and to safely socialize with friends and family. But then in terms of what might be happening with gentrification, while the actual kind of effect on the process of gentrification wasn't so clear, people did talk a lot about changes in social networks and the sense of community in the neighborhood, which is one aspect that we think about when we're studying the health effects of gentrification. They talked about those things being very important in maintaining well-being during this time. And then they also talked a lot about maybe not directly linked to gentrification itself, but they talked about the extreme increase in housing precarity during this time, and about people moving away from dense urban centers and how that affected social networks. Maybe not due to housing precarity, but due to personal preferences. And having actually the ability to do so. And then as Nuria talked about in the video, almost everyone mentioned this extreme increase in the visibility of homelessness, which may or may not be related to gentrification. So many thanks to Ita, my co-principal investigators. And then these are all of our data collectors that helped out during the time, our collaborators at Quincy's, and our advisors, including Isabelle here. And that's it. Thank you.
Thanks so much, Helen. So now we go to the final presentation from Oriol and Marquet. Thanks.
Okay, thank you. Thanks for the invitation to talk to you today a bit about the Superblocks project. I'm not going to present one specific project. I'm just going to comment a little bit on the links between the Superblocks project and the transportation changes that they are bringing, because from what Helen and Isabelle were telling us, most of the expected outcomes of the Superblocks depend on one thing, and that is that the Superblocks are an effective way to actually change mobility and change transportation. And maybe we tend to assume that that is true and that it will just happen because we implement a superblock and then people will stop using cars or something. Like there's kind of a big assumption going on here that I think we can reflect on a little bit and see what the limits of this relationship between superblocks, green axis, built environment interventions can bring us closer to the sustainable and equity principles that we are looking for in our city, right? And so I'm just gonna start by reminding what are the main objectives of the superblocks, which were rationalize mobility, improve environmental conditions, expand spaces for leisure and social activities, encourage contact with nature and foster social cohesion. That's what the latest move on superblocks, superillas, brought by the Ayuntamiento highlights as the main aims. And these have changed a little bit from the beginning of the superblocks to what we are calling now. Now we are obviously putting more emphasis on the part of social equity and social participation and the idea of a feminist city, etc. Maybe in the beginning it was more like an urban intervention project for traffic, for traffic calming, model change, etc. So, where do we come from? We come from a city, as you know, that has very good conditions for walking because it has very high density, very good land use needs, etc. But at the same time, we have 1.5 million trips every day made by car. And 60% of the public space is devoted to the car. I don't know exactly where that 60% figure comes. Honestly, it's something that everyone repeats. I've never found the source. But if you take a look at it, the car does have a big presence, and especially in some districts like the Eixample, all you see is cars, right? So there was a point in trying to implement some strong measures, some strong initiatives that could change this dynamic. And this is not, this goes beyond a political issue because, as you know, the Superblocks concept starts before the actual city council was introduced. This comes from the 2010s. And so these city council that we have right now, it has really signified themselves by pushing these policies, but the policies were already there. Okay, that's important to understand. So there was clearly a need to change things, and so the original model, as you will know, devised this design made by Barcelona, by Isabelle. It was a very specific design of 3x3 blocks using street directions and street pacifications to create more public space and to not allow traffic to go through a specific area of the city. And so this is, as Isabelle was saying, very localized action, very intensive in terms of changes of users, traffic, and public space. But this was meant to be not deployed as an isolated intervention, but deployed into several superblocks throughout the city, right? Now, it has varied the number of superblocks that we're planning. There were 10 that we're seriously planning, but at the moment what we have is 2 really superblocks, right? The San Antonio and the Poblano one. The others are more strategic changes of public use, but we cannot call them as the real superblocks that were being designed at the beginning, right? This is because this has been extremely difficult to implement due to political opposition, also popular opposition. Some criticisms were fair, others were clearly unfair. Everything was there. But the fact is that creating these superblocks has been a very a war of attrition for the politicians, and at the end what we have is 2 main superblocks going on, right? But what's important here is that the original model was highly intense and highly localized, right? And so we have the Poblano and the Superilla. By the way, I invite you to check the latest book by the Ayuntamiento on the Superilla. It's really outstanding. It has a very beautiful design, and it explains very well how the the decision process changed from the beginning to the later stages of the process. So that was really great. So if you think of the Superilla in the context of the Barcelona model, I will explain these maps in a bit, but I will leave them here because I like them when I talk. What of the Superilla? What is the mechanism between the Superilla, the Superblock, and the traffic calming or traffic reduction? The mechanism has two parts. Think of it as two sides of a coin. First of all, by creating better public space and better conditions for walking and cycling, you are incentivizing people to walk more, to use the bike more. Okay? But the fact is that in Barcelona, the built environment, the urban design is already very highly walkable almost everywhere. And for sure, in the places where the Superblocks were implemented or were being designed, right? So there's a kind of diminishing returns of just trying to increase walkability because what we know about walkability is that what you just need is a minimum amount of walkability. So you need the streets to be walkable in order to get people walking, yes. But by increasing walkability, you just don't get more and more walking because there are other factors that come into play. Socioeconomic factors, political factors, habit factors, whatever, okay? The same applies with bikeability, although in terms of bikeability, Barcelona has much more room to grow. But if we look only at the Superblock model, it's not a revolutionary thing in terms of bikeability. We get some benefits for sure, but it's not a major change. Okay, and so in general, also accessibility in Barcelona is very, very high. So I don't think the Superblocks model could get a lot of benefits from just the improvement of walkability conditions and the improvement of proximity, okay? What we have here is, I don't know if you've heard, this latest trend of the 15-minute city index, and how close do we have all the things that we need in our daily lives from our home, and so green areas will be very accessible areas, and you see that Barcelona has very high accessibility. As a curiosity, the higher accessibility levels of all the city are actually found in the San Antonio Superblock. In San Antonio Superblock, if you live there, you will have access to almost everything you need in less than 8 minutes by walking. Right? It's super, super accessible. I don't know if the Ayuntamiento deployed the Superilla there because of that. I don't think so. It was just a matter of convenience. But it's a nice coincidence. So if the actual improvement of the built environment is not going to get us just more walking or less cars by itself, how are we expecting to get the benefits in terms of traffic reduction? What we are betting on is a concept that is called traffic evaporation, right? And this concept assumes that the number of cars that want to go to a specific place through a specific route is not fixed, and it's actually changeable. And so if you imagine, for example, car traffic, this is very understandable. If car traffic have 4 lanes available, and because we implement now a Superblock, there's only 2 lanes available, what's going to happen is probably that some of the people that wanted to drive through there will see the new conditions and will act upon these new conditions, right? And some of them will expect, oh no, that route will be too congested, so I'm going to use the public transport instead. I'm going to use the bike instead, or I'm going to use that trip but on a different time of the day, for example, or I'm just not going to take the trip because it was not necessary for me. Right? And so these dynamics, in theory, what gets us is that by reducing the number of space that we devote to the car, we can also reduce the actual number of cars. Now, critics of the Superblock will tell you this is not going to happen. What happens is that if you reduce the number of lanes for cars will find another alternative route. right? So what's at play here is, do we believe in these traffic evaporation models, which have been tested before, or do we believe that traffic is just what it is and there's always going to be traffic, and so if we change the conditions of one superblock, they will find an alternative route, right? In this sense, I want to highlight a very recent piece of research led by someone, Anguelovski, who's actually here. Say hi, someone. You can ask him the details later. But he tested using traffic data in Barcelona, whether if that was true or not. So whether if streets that had an intervention were actually transferring traffic to nearby streets, right? And what he found was that in the streets, I'm going to explain this very, very fast. In the streets that were received some kind of intervention, traffic went down. That's pretty obvious. But the most important thing is that in nearby streets, in adjacent streets, we didn't see an uptick of traffic in the same proportion as the decrease in traffic that we observed on intervened streets. That tells us that there's some kind of traffic evaporation going on here. That the reduction of traffic from the intervened streets was not transferred either in the adjacent streets or the nearby streets. So that's a good piece of evidence that the principle of the superblock is triggering some kind of traffic evaporation effects, and that plays well into the aims of the superblock as a traffic evaporation concept, right? But we also have to be a little bit critical of that, because the amount of traffic that we can evaporate is not going to be infinite, right? Because traffic evaporation depends on people having alternatives. So there's going to be a population group that just have no alternative, and they are what we call car-dependent or car-captive users, right? I need to go to work, and because I live very far away from my work, or because I live in a low density area, or badly connection with public transport, forces me to use the car. So in those cases, it doesn't matter what we do in terms of built environment. It doesn't matter how we design the superblocks. We are still going to have this traffic somewhere, right? So the key here is to understand, okay, how many car-captive users do we have in the Barcelona area? And here, what's the challenge for the Ajuntament, I think, is to think, okay, the Ajuntament, the local city council, obviously, their voters are citizens from Barcelona, and that means citizens from the municipality of Barcelona. But the people who come in the city center by car, a lot of them are not actually, do not actually live in the city center, right? So out of 1.5 million trips by car that we have every day in Barcelona, we could say that 600,000 come from the city center, and that's 15% out of the total trips of the city. 15% is not bad, so this can be reduced maybe at 10%, 5% if you will, but this is going to come from this pool of car trips that we have here. The more difficult to manage car trips are these transfer trips. So in the relationship between Barcelona and the surrounding areas, that is the first metropolitan ring or the second metropolitan ring, we have 52% or 53% of car use. And a lot of these are going to come from areas that are very car dependent and are very car captive, right? So if you think of a general map of population density of the area, okay, superblocks will have a huge effect on the car trips within Barcelona, and that's great. But what happens with all the car trips that are generated in these areas, right? Low density, low land use mix, poor public transport accessibility conditions, unless you live in the city centers, right? Places like Sant Cugat, places like Rubí, places, and I'm not talking about the city center of Sant Cugat, but the neighborhoods like Mirasol, like Valldoreix, right? Where you have built environment and urban design that has been completely designed for a car, right? In those instances, the superblocks will do nothing for them, right? They still have to use the car. So how can Barcelona, from a city council's perspective, affect and deal with these metropolitan and scale issues. That's the big thing. And that's more of a governance issue than an architectural or a design issue, right? How can we put everyone on the table and say this is not sustainable, we cannot create sustainable mobility pattern with these urbanization patterns. And that is very difficult to do. Now, as you know, the superblock model has changed, and Isabelle was mentioning it. And now we don't have like these very localized, highly intervened urban areas, but rather the Ayuntamiento says that there's one whole super area and one whole superblock that encompasses all the Eixample, and that all the traffic interventions that we find in this area, from the green access to the opening of new squares, etc., can be considered under the superblock model, right? And this is like transforming the superblock concept into more of a container of just pedestrianization, bike lanes, public space improvements, everything fits in there, right? In terms of scale, we are going from a 3x3 intervention in terms of Eixample blocks to the whole of the Eixample. So in scale, we go bigger. In terms of political implementation, they argue that this might be easier for them because the intervention is more spread out and it will trigger maybe less opposition. We still have to see that, but that's their rationale. And what they are saying is that in the end, they will try to reduce the number of car lanes in this area by 40%. Now, what we have now is the first stage of the project, and this project is a reduction of car lanes of 15%. So it's the first stage of the project is 15% less space for cars, and we have to improve this project until we get to 40%. Okay. I think in this change, they say that this is a logical and narrative change. I think the war of attrition and the constant fight for the superblocks has made them change a little bit, finding the path of least resistance, and that's why we are going from the original superblock model to this green access model. But this also has potentials of, for example, maybe lowering the pressure, the green gentrification issues, lowering the more negative or challenging issues that the original model had. Will it be equally effective? It's difficult to say because when we think of the superblock model, it's one thing to think about one superblock in terms of model change of traffic behavior modification. A single superblock model is going to do nothing. Now, if we think of 10 superblock models in the original sense of the superblock model, that had a real big impact. Now, this kind of watered down model of green access, will it have an effect on real traffic conditions, on the number of cars that we see in the city? Will it make people just choose not to use the car? We'll see. I see there's like a trade-off in spatial coverage and intensity, right? And we gotta see where we are, right? So so the superblock model had a very, very big important step, which was to go from a planning based on the need to circulate fast, efficiently, speed, etc., to planning putting an emphasis on the need to inhabit the public space. So be there, creating good quality spaces where people can socialize. When the only thing is not just traveling for the sake of traveling and accessing, but just lingering in the public space, creating new activities. And just that, it's a big improvement in terms of what we have. So let's take the facts. This superblock model, this political direction that we have right now, is a big improvement from what we used to have, right? Right now we have 75% of all the trips that are done in Barcelona by walking, by biking, and public transport. And the goal is to get this number to 82%. I think this is quite ambitious. I'm honestly I don't think that we will get that. But it's mainly because there's some structural problems that are not being addressed, mainly in the number of car-dependent users that we have. The Superblocks may improve the conditions that we have for walking and biking, but they are not changing the need for car traveling for a specific group of people that still are very car captive. Okay, so how much lower can we get by just changing the city design, right? Maybe we have to find a natural limit of the improvements that we can expect from city design and changing the built environment, and we have to introduce new concepts like congestion charge, things that can create modal change by other means, right? And this idea of how many car captive users do we have in the area, that's going to be key. The metropolitan challenge, I think, it's been completely unaddressed. And I honestly, I don't have the solution for that because it's a clear challenge. When the Ayuntamiento de Barcelona pushes for this Superblocks model, obviously people who see themselves affected because they used to be able to access the city center and their jobs by car rather easily, and now they won't be able to, obviously that creates some opposition. Right? And so this public reaction tests really the limits of acceptability. And this idea of acceptability as a key thing, not only to implement the policy, but we have to understand that if we have a lot of angry opinion about the public, about the Superblocks, this is also going to affect the opinion that citizens of Barcelona have of these Superblocks. Now, you were mentioning that maybe the objective conditions of the people living in some of these areas had improved, but their perception was not of improvement, right? So if the important thing is the perception, maybe we can lower car traffic and we actually measure less car traffic, but if the public opinion says that these Superblocks are creating rebound effects or are creating unintended consequences that are negative, the perception of the people is that we have not improved, or maybe we are worse than we were, right? So these issues of public opinion is not only important for policy implementation, but also in terms of actual perception of the people. And here, Barcelona plays at two levels, because if you look only at the international stage, if you look only at the international press, urbanism blogs, architectural fairs, etc., Barcelona is the poster child for this innovative urbanism. Like, there's the Ayuntamiento has a log of the number of international visits, and there's more of 500 cities around the world that have officially visited Barcelona to learn more about the Superblock project. So we are selling the idea to the world of a transformative urbanism project that is absolutely fantastic in terms of goals, of justification, of mechanisms, etc. Right? But at the same time, in the local stage, we have an opposition that is super loud. It might be heavily politicized, judicialized. It can be fair at times, unfair at times, because there are criticisms, as Isabelle and Helen were pointing out, for sure. There are criticisms to the model, but some of the criticisms that we are getting are not based on that, and they are just political or bad intent in general, right? So there's a political price to be made there, and I'm afraid that the Superblock concept is starting to become a little bit burned out, right? And so we have to be careful, because the Superblock concept was a super useful, super revolutionary design, and what we are doing is two things. First, we are watering it down by converting to a green access project that is not that different from a pedestrianizing project, right? So that changes the nature of what we understand as Superblock. And the other thing is that if these Superblocks don't succeed in Barcelona, if they end up getting imbued by negative connotations, that means that whenever we try to implement Superblocks in another place, these negative consequences and these negative opinions will come with the project, right? And that's also a negative thing. And at the same time, I'm going to finish with this. I think the Superblocks are extraordinary and are not extraordinary at the same time, right? If you think of the Superblocks, it's just a project that tries to use built environment change and built environment and city design to take away space from cars, give it to pedestrians, make more difficult car traffic. And that is no different from what other cities are doing. London, no traffic neighborhoods, Paris with the 15-minute city concert, Milan, even Madrid would be on the opposite side of the political spectrum. They have a low emission zones in Madrid 360. Okay, so that's not different at all. The Superblock model in Barcelona is not revolutionary in the aims, in the goals of the project. But at the same time, it is a revolutionary model because it changes the priorities. It has a very ambitious scale. It has a very good ability to sell these ideas to the world, and it has very good, very well thought objectives in terms of not only thinking of the Superblock not only as a traffic reduction project, but as a social aspect, as a feminist city building block, etc. Right? So it is a very new thing, and because it's very new, we have found a very organized opposition. And how do we deal with this opposition? If you want, it's also a new thing, right? We have to learn on how to better implement these policies. Like maybe the research priorities right now are not on what do we have to do to create more sustainable cities, but actually how can we implement these efficient policies that we have found that they are useful, right? And just to finish up, I think that this is a very obviously interesting project for the city that we have to keep tracking, keep monitoring. There's multiple agencies doing wonderful stuff, from Barcelona, Agencia de Salud Pública, to IS Global, to ICTA. From very different perspectives, we are analyzing the different impacts that this Superblocks model and these changes in the built environment have created. And I think we have to keep doing that because there are very important lessons to be learned. Yeah, that's it. That's it. Thank you so much.